Hello everyone and welcome to our module on trisomy. Trisomy disorders are disorders that occur when a baby is born with 3 copies of one of the chromosomes instead of 2. The most common trisomy disorder is Down syndrome, which is trisomy 21, which I talk about in a separate module. In this module, we'll talk about 2 less common trisomy disorders, Edwards syndrome, which is trisomy 18, and Patau syndrome, which is trisomy 13. All of the trisomy disorders on the last slide, Down syndrome, Edwards syndrome, and Patau syndrome, share some common features which can help you to remember them as a medical student. First of all, they are all associated with advanced maternal age, and they are also all most commonly due to meiotic non-disjunction, which I discuss in more detail in the Down syndrome video and the video on meiosis. In addition, all 3 of these trisomy disorders share common features including intellectual disability, physical deformities, and congenital heart defects. And an easy way to remember Edwards syndrome and Patau syndrome that I've always found helpful is to just think of them as more severe versions of Down syndrome. Children with Down syndrome can be functional and sometimes can live long lives. Children with Edwards syndrome and Patau syndrome are more severely disabled and often die in utero or early in life. We'll start by talking about Edwards syndrome, which is trisomy 18. This is the second most common trisomy in live births. Down syndrome or chromosome 21 trisomy is the most common. Children born with Edwards syndrome have severe intellectual disability, and this often occurs in female babies. There's a 3-to-1 female to male ratio. Babies with Edwards syndrome have poor intrauterine growth. They are often born with a low birth weight. One of the characteristic features is a very abnormally shaped head. It's often very small, and the back of the head protrudes out. This is described as having a prominent occiput. You can Google this and see pictures of baby with Edwards syndrome. Their head is very misshapen. The ears are low set, just like in children with Down syndrome, and they often have a small jaw and mouth. And then 2 characteristic features that are often helpful, especially in board questions, are that children with Edwards syndrome often have clenched fists with overlapping fingers, like as is shown in this picture on the screen. In addition, they often have curved feet that are described as rocker bottom feet. Just like Down syndrome, Edwards syndrome is associated with congenital heart disease and gastrointestinal defects. Congenital heart disease occurs in about 50% of babies. It's often ventricular septal defects or PDAs. Gastrointestinal defects are more common in Edwards syndrome than in Down syndrome. In Down syndrome, they only occur in a few percent of cases. In Edwards syndrome, 75% of babies have a gastrointestinal defect. It's often a Meckel's diverticulum, but can also be malrotation or an omphalocele, and I talk about all of these congenital GI defects in the gastroenterology section. As I said before, an easy way to remember Edwards syndrome is to think of it as a more severe form of Down syndrome. Children with Down syndrome often grow into adulthood. However, most babies with Edwards syndrome die in utero, and 50% of affected infants die in the first 2 weeks of life, and only a few percent survive the first year of life. Many cases of Edwards syndrome are often diagnosed by fetal ultrasound. These babies have so many physical and congenital abnormalities that you can often identify them in the womb. You may see limb deformities, you may see congenital heart defects, you may see that the skull is misshapen. If the case is not diagnosed by fetal ultrasound, there is maternal blood testing that can be used to suggest the diagnosis, similar to the way it is used in Down syndrome. I talk about this in more detail in the video on Down syndrome, but there are first trimester blood tests that can be done in the mother to determine the likelihood that the baby has Edwards syndrome. So the 2 blood tests used in the first trimester for Down and Edwards syndrome are PAP-A and beta-HCG. In the Down syndrome video, I talked about how levels of PAP-A are lower than normal in pregnancies associated with Down syndrome, and beta-HCG levels are higher than normal in pregnancies associated with Down syndrome. In pregnancies associated with Edwards syndrome, both levels are low, and in fact, it's very easy to remember the screening results you would expect in Edwards syndrome because they are all lower than normal. In the second trimester, there is a screening test for Down syndrome called the quad screen. This test involves measurement of the serum levels of 4 markers of Down syndrome in the mother's blood, and those 4 markers are AFP, estriol, beta-HCG, and inhibin A. These 4 markers in the quad screen can also be suggestive of Edwards syndrome. In Down syndrome, the first 2, AFP and estriol, are typically lower than normal, but the last 2, beta-HCG and inhibin A, usually have levels in the mother's serum that are higher than normal. In Edwards syndrome, the levels of all 4 markers are usually lower than normal. Moving on, let's talk about Patau syndrome, which is trisomy 13. This is much more rare than Down syndrome or Edwards syndrome. You can think of it as a much more severe syndrome than either Down syndrome or Edwards syndrome. Babies with trisomy 13 have severe intellectual disability, they have severe structural malformations, and it's usually detected by fetal ultrasound in more than 90% of cases because the babies are so abnormal when ultrasound pictures are obtained. Some of the key features I've listed on this slide: the eyes are often abnormal. These babies can have microphthalmia, which is abnormally small eyes. They can also sometimes have anophthalmia, which is absence of one or both eyes. They often have a cleft lip or palate, and another characteristic finding is called post-axial polydactylity. So polydactylity is an extra finger or toe, and post-axial means the extra digit is away from the midline. So in other words, in the hand, it's on the ulnar side. Shown on the screen is pre-axial polydactylity on the top. That's where the extra finger is on the thumb side. The bottom of the screen is post-axial. That's where the extra digit is on the ulnar side of the hand. You can also see extra digits in the feet. These babies often have holoprosencephaly. I discussed this in the embryology video in the neurology section. This is a central nervous system malformation where there is failure of cleavage of the prosencephalon. This leads to left and right hemispheres of the brain that fail to separate. It can result in an alobar brain where there are no apparent lobes of the brain present. Congenital heart disease is very common in trisomy 13, seen in 80% of cases. It can include ventricular septal defects, PDAs, and atrial septal defects, among many other abnormalities. As I said before, this is a very severe chromosomal anomaly. Most cases die in utero. The median survival after birth is 7 days, and 91% of babies with trisomy 13 die within the first year of life. And I mentioned this before, but usually trisomy 13 is diagnosed by fetal ultrasound. If first trimester maternal serum screening is done, the results will be abnormal in a similar manner to the way they are abnormal in Edwards syndrome. Both Edwards syndrome and Patau syndrome give levels in the maternal serum of PAP-A and beta-HCG in the first trimester that are lower than normal. This is in contrast to Down syndrome, where the PAP-A level can be lower than normal, but the beta-HCG level is higher than normal. And that concludes our video on trisomies.